Hello, I'm Sergeant Eileen Stewart with the Winnebago County Sheriff's Department Corrections Administration. It is with immense gratitude that the Sheriff's Department is the recipient of grant funding by the Winnebago County Community Mental Health Board. Today I am joined by several individuals that all work together in Winnebago County Corrections through the Winnebago County Sheriff's Office to achieve the objectives of the Winnebago County Jail Behavioral Health System Enhanced Program. Our goal here at Winnebago County Corrections is to assist in reducing overdoses and overdose deaths and increase recovery in Winnebago County. Studies have shown that the transition from jail back into the community can be very difficult for those individuals who stopped the treatment received in jail once they have integrated back into the community due to a lack of programs, medication, therapy, and counseling. Expanding the existing mental health discharge planning and addiction services to now include a medication-assisted therapy program, MAT, with the help of the grant funding received. The MAT program allows for sustained continuity of care for individuals in custody. This is to ensure that confined individuals will have assistance and will not have any relapses or withdrawals while in custody and in hopes once released back into the community.
Good afternoon. My name is Christy Wilson. I'm the discharge planner in the Winnebago County Jail. My role here is to link inmates to services, set them up with a discharge plan to make sure they are successful once they are released from jail. Oftentimes, inmates don't even have something as simple as an ID. I can help link them to get an ID, so I can help get them housed, help them get a phone, help them get the essential things that they need out in the community. Housing, mental health, substance abuse. There's lots of resources in the community, and I make sure I set up a solid discharge plan so they are successful once they are released from jail.
Hi, my name is Sana Siddiqui. I serve as the mental health coordinator for the Winnebago County Jail. I work with the Winnebago County court system to help address the needs of incarcerated individuals whose mental health plays a factor in their incarceration. Through referrals to diversion courts such as therapeutic court, drug court, Veterans Court, and Wellness Court, through collaboration with the state's attorney's office as well as the public defender's office, as well as collaborating with providers in our community. I strive to connect people in the criminal justice system to appropriate and compassionate care, both inside and outside of our facility.
Hi, my name is Tammy Burke, and I work for Winnebago County Jail for Freedom Mental Health, and I am a qualified mental health provider. I also carry a license as an LPC, and I'm a master's degree clinical psychologist. I want to tell you a little bit about the class I do teach, which is a wonderful class. And I have the book here. It's called Houses of Healing, and it's a prisoner's guide to inner power and freedom. And in teaching that class, it's a 12-week class, which includes homework assignments, videos. We do reading aloud. We have time where we just sit and process, which gets each individual person in my group the time they need to process maybe something that we stumbled across that really has affected their life in a very positive or negative way. Houses of Healing is just it's a long and winding road from childhood to incarceration, which many of my patients have been so traumatized in their life. They haven't had any resources. They've had no guidance. They've had no families. They've had nothing. So it is a very intense class. It deals with trauma, and I try to keep that to a minimum because dealing with trauma can bring up so many negative feelings that are just devastating to the person. We share many tears, many smiles, but I'm all in, and they realize that. And I love working with this population. Thank you.
Hi, my name is Kirsten, and I am a QMHP and the Substance Recovery Lead for Freedom Behavioral Health in the Winnebago County Jail. Um, as far as tasks and duties, I work with 3 other mental health clinicians and the nurse practitioner, and then a discharge planner. Um, we do mental health rounds, which is seeing those people who are considered mentally ill in the jail. Segregation rounds when people have time in segregation, primarily doing the mental health intake screenings, and then individual contacts with people when they put in requests or corrections or medical census referrals. In those requests, sometimes it is for medications, sometimes it's for discharge, and sometimes it is specific to substance abuse. And being that that's my kind of main role, I do meet with people individually and do a couple of things. So I run this group, which is the Stop the Chaos. And this is just a one-on-one kind of basis that I do right now when people ask for things specifically. And then we also have the MAT journal for those people who are receiving our MAT services. And then collectively as a group, I do the co-occurring disorder class, and that is through Hazelden and the Minnesota Department of Corrections. And it is formulated specifically for those who are incarcerated, talking about both addiction and mental health treatment and what that looks like and how to maintain recovery for both mental health and addiction. Outside of that, we work with the fitness people to provide information as far as fitness and transfer to DHS, and then just kind of anything else that comes up.
I'm Megan Johnson, licensed clinical professional counselor. I'm a site mental health manager at Freedom Behavioral Health, the Winnebago County Jail. I oversee mental health's day-to-day operations in the facility. In addition to myself, we have 3 other qualified mental health professionals, 2 part-time psychiatric nurse practitioners, and a discharge planner. Outside of my administrative duties, I also oversee the majority of the mental health care on the 2nd floor of the jail, which houses the specialty pods. These include male and female mental health, male and female medical, and male and female restrictive housing. I perform suicide risk screenings for those on suicide watch. I also complete mental health intake screenings for new inmates housed on the 2nd floor at time of booking. Mental health rounds are completed in each mental health pod every 2 weeks. We also collaborate with community psychologists who are assigned by the court to complete fitness evaluations and with DHS who complete the placement evaluations. Our team also has the ability to work with community providers like public defenders, probation officers, mental health agencies, and the crisis co-response team to ensure that each patient has the resources to receive care. We are grateful for the assistance from the Mental Health Board to be able to perform these enhanced services.
Hi, I'm Kevin Verdi. I'm one of the QMHPs with Freedom Behavioral Health. I've been here since 2022 when we started the new grant expansion mental health services here. I'm a licensed marriage and family therapist, though I don't use that here. I have been with the mental health, criminal justice since, for the last 13 years. Here at Freedom, primarily, we're focused on doing the screenings, like mini assessments, basically so that we can get patients linked up with the mental health services that they need. I do referrals for the mental health provider here for psychiatric medications, specialty courts, also to our discharge planners so that they can really get the people linked in the community so that we don't have that recidivism and have people coming back here. So our main goal is to keep people out of here healthy, well in the community. So one of the things I also do is a cognitive behavioral based group. It's called Thinking for Good. If you've heard of it, MRT, that's a evidence-based and best practice program. It is a cognitive behavioral program which focuses on disputing our irrational beliefs, behaviors, attitudes, things like that, and causes a cognitive dissonance, which means we need to basically overcome that schism between what we think and what we do. Other ancillary duties, we do kiosk requests, patient requests, just other miscellaneous duties, such as consulting with the fitness doctors and the medical staff.
Hello, my name is Pearl Asanji. I'm a psychiatric nurse practitioner here at Winnebago County Corrections. Here I provide psychiatric services to the inmates where I assess, plan, and diagnose. A lot of times I'm placing bridge strips for patients that it makes their transition from the correctional facility back to society pretty easy.
With the continued support of the Winnebago County Community Mental Health Board and our joint collaboration with several other agencies also receiving funding, we have been able to connect numerous incarcerated individuals with the necessary and vital services that they are in emergent need of. With appreciation and thanks from the Winnebago County Sheriff's Department, we look forward to being able to provide continued life-changing programs and services for individuals both living and working in Winnebago County. Thank you.